don't follow the restrictions. Come on, senators. He also commented 40 people in the hospital, and we don't know how much more were admitted since last night's JIC. Gene writes, need to go back to stay-at-home orders or even order a curfew. So there you go. That's what the people are saying on the Facebook. 822, Superintendent Jon Fernandez, the Guam Department of Education, joins us in our KWAM News Zoom room. Good morning, John.
Off today, Chris. Good morning.
Thanks for joining us. We'll just go ahead and start. I know you got a lot to update us on, so we'll go ahead and give you the floor and do that, and then we'll pop in with some questions after.
No, absolutely. Well, first of all, I just want to inform the community that there's been a lot of questions that we've been receiving over the past few weeks about laptops being distributed. So right now, we still are getting those questions, and I want to let everybody know that they do very much need to be in contact with their schools. Give their schools a call if they haven't yet received information about applying and receiving laptops. So there is a directory on our website, www.gdoe.net, for contact with our schools. But basically, the schools are handling the application process. It started last week, and my understanding is that distribution also for some of the schools started last week as well. And we'll be pushing those laptops out. I think JFK was able to do about 50 a day. So there is going to be some limitation on how many computers are able to push out daily. But over the next 2 weeks, we are anticipating distributing around 8,000 laptops and tablets to our secondary school students, and hopefully expand the online option for many of our students. So if you need to apply or you have questions about the laptop distribution, the first place to call is your school. And again, for phase one, we're talking about middle school and high school students. Elementary school students, we will be looking at distributing later once we get the new equipment coming in, and that'll happen probably towards the end of the semester. So that's what I wanted to say about laptops. I know we've got a lot of questions also about internet access, and so I know we testified before the legislature yesterday to clarify where we were. Again, the funding that we're using to support internet access at home is coming from the governor's office, and I know they've earmarked about $8 million to support that effort. I think I'm not sure they got approval of their budget yet, but once they do, our plan is to move forward and to procure internet access from our providers to service our families and students who need internet access to take advantage of our online platform. So again, that's going to take another month or so to really get done. But it is on the way, and I wanted to just let our parents know, because we do get a lot of calls, a lot of excitement about it. I know there are a lot of families who have been trying to deal with the hard copy form of learning, and that's been challenging during Peak Core 1, and it's just a completely different way of trying to get your work done. So we do hope by the end of the semester we will see a significant amount of students now going completely online, and that'll help us and help our teachers focus in and improve what we're doing on that side of the learning equation. So I think additionally, I wanted to, I think we haven't made it up. We definitely haven't made a final decision, but there are several decisions that we are needing to make as we get through this part of the semester. Two issues that have come up that the board will need to take action on this month are looking at grading policy for this semester. It's been very difficult to figure out how to give grades in the normal way, compared to regular years, given the fact that a lot of transition of students onto the distance learning platforms. We're dealing with a lot of kids that we've got to reconnect to the school system, so we know some are behind. And then online assessments are just really different from doing them in person. So we're looking at grading policy, we're looking at attendance policy. A lot of our teachers are asking, how strict do we need to be if someone's on our online class but didn't show up for their online class? Is that tardy? Is that absent? So we're reviewing those policies. But I think the most important issue is that people are asking us, is there a final decision on classes, on face-to-face for this semester? And we're getting close. And I think, if I had to make it today, I think that we're in a position where we have to delay face-to-face until next semester. But we haven't made that official yet because we really do want to see and make sure that we've got the laptops out there and that we have a better sense of the number of kids who are still missing and not connected. But based on the public health situation, and we've been tracking that daily as everybody else has, it doesn't look like we'll be in a position to effectively implement face-to-face. If we don't get there until mid or late November, it just won't make sense to come back for a couple of weeks and then go on break. So, we've been discussing with the governor and her team about reopening possibly next semester. And I think the challenge is if we're going to open in January, if that's even a possibility for face-to-face instruction, we have to have that discussion right now. And so, we're going to be talking to her about how to open that discussion again with her and the doctors, public health. We're working on what we call a dashboard, really tracking day to day those risk factors that are relevant to the schools. So that we have, and this is a framework developed by CDC that we're adapting for Guam, so that we can have hard data and use the science and use the guidance from CDC to guide us, over the next couple of months. I really am, I know that all of us want our kids to be back in school, but we can't make those decisions based on the last letter or opinion piece or editorial about why it's important. We know it's important, but safety is the top priority. And so we really are looking and leaning on the science to kind of help us guide our decisions over the next couple of months. But as you know, and with the numbers, and I've been listening to your show, is that there's just high anxiety levels. I mean, our principals, our teachers, our staff are working really hard, but also, having to deal with their own anxieties about safety at the schools, safety in our operations. So it's really going to take a lot of work to communicate and reassure our entire community, our students and families as well, when we get to that point and say, where we're able to say, come back to school and come back in this manner and, and know that you're safe. We were even going to be revisiting whether we come back all at once as a district like we were planning to on an alternating schedule, or whether we look at certain grades, look at certain groups of students. We know that our special education students, our students with disabilities, their families have really expressed to us the difficulties and challenges in educating kids at home with the online, with distance learning versus the supports that they would normally receive at school. So all of those discussions we are restarting again internally and with the governor's office, and we hope to have a more public discussion, keep the community informed as we go through these next 2 months, because we're not going to reopen on a dime. We're not going to be able to change direction that fast. It's going to be a steady process, and the public health situation has to improve. So let me go ahead and stop there. I mean, those have been the issues that have been coming up for us, the technology, and then the question about reopening. But I'm sure you may be getting other questions or comments, and I'm happy to answer any.
Hi, John. Where is the Guam Department of Education in being able to reach the students that have not yet been able to participate in any learning since the first day of school?
Yeah, that's been a major concern to us. And again, over the summer, we had our students register for their models of learning, and we saw that 4,000 students that we expected to respond had not responded. And of course, we just figured that, okay, once we get to the first day of school, they're going to show up, and we're going to get a lot of them just by virtue of the fact that they physically could report to school, and that should take care of a majority of those cases. Unfortunately, we didn't get a chance for the students to report to school. Mm-hmm. So since the first week, we've had to rely on phone calls and emails and whatever other ways of communicating that we had on file and on record. And, we started over the summer with staff. As teachers came back, teachers then participated in that outreach effort. And then, just over the last couple of weeks, we've really deployed our social workers and our student attendance officers to take over that operation and really, work over, double time to get that work done. So we were at 4,000 at the beginning of the year. We were about 2,800 students, maybe 2-3 weeks ago. And then we've been able to reduce that number or just over 1,000 more. So we have about 1,700, a little bit over 1,700 students that we're still trying to connect with. One of the challenges, of course, Sabrina, is that, if you can't contact anybody, the next step is a home visit. But during PCOR 1, we're not allowing our employees to go out to people's homes. And I don't think people will be, welcoming visitors to their homes during PCOR 1. So we are just really holding on until we get to a situation where we can do that. We will be working with the Mayor's Council just on the contact information. If they have different contacts, updated contacts, in case these families are being served by the mayor's offices. But other than that, we're really going to have to wait to a situation where we can go out to the homes and check on the families. Some of the anecdotal, information that we have is families that have just moved, have had to, I don't know that they were evicted, but just had to relocate their housing because of an inability to pay rent or just a need to relocate somewhere else on the island. We know that there are a lot of economic challenges for our families. So we know that there are families who are saying, hey, school's not the first priority for us right now because we're looking at housing, we're looking at our income, we're looking at food, water, and so forth. And, we also know, we're trying to work with the global dorm with our homeless families to connect to some of the kids that are over there. And we just, recently received some census information about the kids who are there so we can reconnect them to school. And these are kids from all over the island who are now, centralized in a central homeless facility. So we hope to make more progress. And that's really been a tough, that's been a challenge, not just a challenge in terms of reaching the kids, but we know that there's a possibility, a probability that when we get the chance to dig into these cases, we're going to see more than just kids who didn't want to come to school. We're going to really be face to face with families in traumatic situations that we really have to be aware of and try to address as a community.
I did want to ask, on the releases that we get from the Joint Information Center, it always makes a notation of the latest round of GDOE employees that have tested positive for COVID.
Yes.
Do you have a final account on how many exactly employees of yours have tested positive?
Yeah, and well, let me first say this: we have been shut down for most of the summer. Mm-hmm. We did come back for a couple weeks, and then we've been shut down for the most part ever since. Of course, we do allow teachers and staff to come in on, as long as they are coming in and under safe conditions. Meaning, we don't expect. There's no faculty meetings. There's no staff meetings taking place. They're going to their rooms because they want to use their rooms for their classes, or they're participating in the distribution of materials and food. So it's pretty limited. And again, we've been shut down for the most part. All the cases that we have about 58 cases that we've identified since the summer of GDOE employees. However, let me clarify that these are not, that the majority, if not all, of these cases are being discovered through contact tracing. Mm-hmm. So what's happening is that they're being identified and as contacts for positive cases that have happened outside of the schools. So there isn't, I've been very concerned and working with our chief nurse supervisor to track and to be aware of any possibility of spread within a school, based on the fact that people are together at school. But for the most part, I haven't had any evidence of any spread within the school facility. It's all coming from outside in the community. And, but again, we just feel that it's important for our stakeholders, if they're going to trust the information that we're going to give them about being safe to return to school, about coming to pick up their food and their supplies, that we ought to share all the information that we can about the impact of COVID-19. So sometimes it seems like we're the only agency that has any positive, because every day that we get a case, our instruction is put that out to the community so they understand and know what's happening. Otherwise, I don't want to be in a position where you're going to say, hey, you had all these cases, but nobody ever shared it. So how do we know you're going to share your information going forward? And we definitely don't want to be in that position when we have so many people trusting the decisions that need to be made.
Are any of these teachers, though?
We have teachers and staff, right? I mean, and you can guess. So that, so one of the calls we'll get is, we have a certain person at a certain school that's informed us, or we've been informed that they've tested positive. Usually the employee is the one who notifies us first. And then we say, we get a handle on the circumstances. Sometimes it's, well, my spouse was tested positive at work. I was the next contact. Now I've been diagnosed positive. And so we kind of get a sense of where it's coming from. Usually some of them haven't been to work, haven't been on site for 2 to 3 weeks, but we still report those because they are part of our DOE family.
Yeah.
We don't actually go forward until we get DP, public health, to verify and validate that information. And then when we do that, we basically identify, the individual school, location without giving personal, identifying information.
Yeah,
So we want to make sure
I
we
just
maintain the privacy, but we need to share some level of information with
right.
our,
Yeah,
with our
I
employees.
was just asking about the teachers because does it impact? Have they gotten sick where they could not continue to hold their classes online?
Well, there's 58 cases, so there's different circumstances. I know we do have a couple who've been hospitalized. I'd have to go back and see whether that was a teacher or staff. But in some cases, depending on what they're doing in terms of online or hard copy, they're able to isolate at home, and depending on their symptoms, may be able to telework and continue to do their classes or work with their teams to have their classes covered for them. So it really is a sort of a collaborative method. But I think again, depending on your symptoms, in my recollection, there's only been really, of the 58, maybe 1 or 2 who've required hospitalization. So so the others are going to necessarily be at home.
I did wanted to give you the opportunity real quickly. We've heard from the Guam Memorial Hospital on the 17 nurses, right, that were sent over to GMH and to GMH, and they were going through their orientation. And so I wanted to see if you had anything to say, on their behalf in terms of their decision to decide not to continue on.
Well, absolutely. I mean, I was very disappointed to hear the way those comments were portrayed, or where the information was portrayed. I do have a good relationship with the GMH administrator, Ms. Lillian, and we met several times on this issue. And basically it comes down to this. There has been an ongoing shortage of skilled nurses at the hospital. This has happened before COVID-19. So we understand the needs that are there. But number 2, we do have nurses who are registered registered nurses who are licensed nurses at our schools, but essentially they function as community health nurses, just like the nurses at public health. And if anybody in the nursing profession understands there's different levels of specialties. So when we came to, stepped up to volunteer and to report based on the governor's directive, there was a decision that, basically around half, a little bit over half, were going to public health to support the community health options. There were some nurses with hospital experience or others willing to train and go through orientation to serve the hospital, and they were the ones who were assigned to report for orientation, training, and eventually to be independently functioning at the hospital. My understanding of what happened is that, well, first of all, that week that they were reporting was the first time we heard publicly that there were 30 COVID cases at the hospital amongst the staff. And I was concerned about that. And I talked to Lillian about that, because I said, look, it's very hard to convince and reassure my nurses when that information is just put out there. And I've been telling them that they'll be in non-COVID areas to start out with, and they don't have to be as anxious as we, of course, would expect them to be. But at the same time, so with that heightened anxiety, I know they went through training and orientation. And at some point when we met, I think GMH basically decided that training and orientation might not be the best use of their resources because of that, that process and the expending that time to get them fully equipped to be independently functioning at the hospital. I mean, there's no way you're going to get a community health nurse to step into the ICU or to the ER or to some of these more specialized areas. So I think it was really a choice of saying, hey, you know what, we can either get specialized nurses that are available. They might be coming from off island. They might be available on contract, versus trying to get, these 17 nurses up to speed and fully reassured that, that they can go home to their families and be safe at the end of the day. So it really was amicable when we had that discussion. I asked GMH, do we, are there issues of resistance from our nurses? Are there issues of insubordination? Because if that's the case, that's really not acceptable, and I'll handle that. but really it was the tone was, we understand their anxieties. We know that there's anxieties coming into the hospital setting, and it just might be too much to do to try to get them stable and settled and comfortable, versus like what I understand is you had other options that were on the table. So all those nurses didn't go home. They went to public health, and they're reporting to public health to support the community health, contact tracing, any testing that goes on, and handling the calls from the community. So they are still working. They just aren't at the hospital setting. So I think that's really more of my characterization of that. And again, I want to thank our nurses. I mean, they haven't been given administrative leave. They haven't been sitting at home teleworking. They've been out each and every day at the ports, at the airports, at the quarantine facilities, at the hospital, even at GRMC throughout this time. So all of our nurses, including our GMH and public health nurses, we really want to thank them.
All right. Well, thank you, John, for coming on and giving us an update. We've got to move on over to the Guam Election Commission. So appreciate your time.
Thank you, John. On your way out,
right.
grab some of that virtual malasadas that's right there on the corner table.
All right.
By the way, tell Melissa the cake was awesome. It was really
Okay,
good.
I will.
Oh my gosh.
She told me about that. All right.
Yeah.
Thank you.
All right.